be a short presentation first, and we'll talk mostly about, I was asked to talk to you guys about lifestyle changes and dietary things that we can do for stroke prevention. And after that, I would love to open it up for a conversation and chat about any questions you guys have, anything you guys want to talk about, anything that could be a resource. We'll just wait for some people to gather and then we can start.
All right, that sounds good. Thank you for joining us.
It's a pleasure. Thank you.
Thank you, Dr. Kharal. Sorry, I'm driving. So I'm going to mute myself for just a little bit, and then when we have enough people, so Shannon's here.
Yes.
So hopefully any connectivity issues, then we should be able to iron that out. Shannon's brother had the stroke, and then she's helping us out from, she runs the Facebook page. She helps us out with the support group, social media connections, and then of course, through the pandemic, getting our reset support group virtually, she's been a big part of all of that. And then we have other members joining in, and they can introduce themselves, like probably after your talk is done. And it's such a good group on the website, and I enjoy spending my time with them every, we meet one Thursday a month. And it was very good before the pandemic. We would be looking forward to a spring gathering at this point. Yep. But anyway, now we'll have to do virtually until hopefully maybe in the later half of the year, we might be able to start our meetings up again.
Oh, that'd be great.
I thank you, Shannon. It's really admiring all the work you do and the time you give to this beautiful cause. So thank you. I will just say, I mean, beyond Dr. Sundarajan's biases, she speaks very highly of you all. I know she's a West Sider, so you all have a soft corner at your heart, but she loves you all so much and the West Side that she's really been pushing me to buy a home on the West Side and become a West Sider as well.
Don't do it. I'm on the East Side. We can hang with them. We're fine.
Excellent.
Don't give in.
I love the mix. I love the mix.
Evil.
Well, let me say this: I live right in the middle right now, so I'm my heart is both sides.
You know what they say? West side is the best side.
Don't say that out too loud to the east
Yeah.
side.
Yeah, we're like converts. So. Whose puppy is that?
Mine.
Can I please just ask? It says host has disabled screen sharing.
Oh, let
Can
me
you
see.
please grant me permission for that?
Let me get that figured out. Hold on. Okay.
Okay. Jay, I can start whenever you'd like.
Yeah. Oh, perfect. So, do we have most of our participants logged in?
Yes, we have 12 people logged in now, so I think we have a full meeting so far, so people can jump in.
Oh, okay.
And I am recording
Perfect.
it, so if people are late, we can catch them later.
You can re-listen. Okay, excellent. So Dr. Kharal is our stroke expert in stroke in the young, meaning patients who are younger than 50 or have any other rare causes like inflammatory causes. He is the expert to go to. He works primarily in the main campus, but he has clinics in Brunswick as well. So he's going to talk to us today about wellness. He's a huge proponent of a whole of stroke care, encompassing both mental health issues, wellness, nutrition, just in general, treating a person as a whole and not just for the one condition. And as we know, a lot of risk factors that are involved in stroke are chronic conditions, and a lot of it has to do with taking care of as well, making some changes in our lifestyles, and that's what we will focus on today. All right. So, Dr. Kharal, we can go from here.
Thank you so much, Dr. Sundarajan. Again, it's a pleasure to be here. Thank you for the opportunity to come and talk to you guys. I agree with you completely, Dr. Sundarajan. You know, I'm a firm believer that stroke care should be comprehensive care. You know, for us doctors, it's very easy to say, you know, hey, you know, to a patient, here's, you know, sorry you had a stroke. Here's your aspirin. Here's your blood thinner. Here's your cholesterol medicine. Goodbye, right? But realizing that that's not the end of it, and that is just a small portion of stroke care. I mean, the actual or the largest part of stroke care actually happens the moment you leave our clinic door, the moment you leave that appointment and you go back home and you go back into your life, and everything that happens, you know, after a stroke. And a stroke is not just, you know, God forbid, you know, you were admitted to the hospital for stroke symptoms, or you came to the emergency room and goodbye. Particularly, other things that we don't really get to talk about are the socioeconomic, the financial, the mental, the physical repercussions and complications related to stroke care, and the very important factors of lifestyle changes, diet changes, like, you know, and we ourselves fall, you know, to fault to that as well. I wish, you know, I could have the time to sit with my patients more during every patient and say, you know, it's not just, you know, 10 of my patients had a stroke involving the left side of the brain. It's, you know, patient number one, what do you do? Oh, you know, I work in finance, and most of my job is on computer and typing. Oh, I'm so sorry. Like, that person who lost their, you know, function of their right hand is so much more devastating for them versus, you know, someone who's left-handed versus right-handed, someone who loves to sew and loves to knit, or someone who is a public speaker and, you know, lost their ability to speak in the setting of a stroke, or someone who was a caretaker for others, or someone who was, you know, a healthcare worker or a social worker or a community supporter, community worker. And so everyone comes from very different and very important walks of life. And, you know, there is no stroke care that fits all. I firmly believe that stroke care is something that should be comprehensive and individualized. And so part of that comprehensiveness or individualization is not just the part on the healthcare system or the healthcare provider, but a lot of it is our own personal care as well. Yes, the doctors are going to help us tell us, you know, why we had the stroke in the first place and how can we prevent another one from happening. But it takes them what, a couple minutes to, you know, write prescriptions or send electronic prescriptions to your hospital, to your pharmacy. But the most important thing is being able to go home and, you know, figuring out, how am I going to take those medications? How can I afford those medications? Other than medications, are there other things? I mean, you can take all the aspirin and all the Lipitor or cholesterol medicines that we give you, but if you're not making changes in your diet or your lifestyle, you know, then we're only doing a small portion of that stroke prevention. I will hope to touch base on, a little bit upon stroke recognition, its risk factors, and ways for prevention, but mostly emphasizing the importance of diet and lifestyle changes in stroke prevention, because that is the bulk of what you will be doing on your own with some guidance. And it's really hard. It's tough. That this is the harder part, because this requires persistence and routine. And you know, we frequently fall prey to a lifestyle changes, particularly in the pandemic. How many of us have become sedentary, have stopped following the routine of dietary habits that we did, or lifestyle habits that we did? So I do not have any disclosures. I will just say it'll be a fun talk. We'll discuss the differences between an ischemic versus a hemorrhagic stroke, meaning the blood clot type stroke versus a ruptured blood vessel or bleeding type of stroke, and the common etiologies of the blood clot type or ischemic stroke. We'll discuss ways for stroke prevention, and we'll review some dietary and lifestyle changes that help reduce stroke risk altogether. So grab a virtual cup of coffee and some healthy e-snacks for yourself. And, if we were doing this in person, we would have had some, refreshments for you on the side here, which you'd be enjoying. When I've given community talks before, there's always been snacks. That's my requirement to give a talk. Just kidding. But, it's in the world of virtuality, this is the most we can do. So the burden of stroke is significant. Stroke remains the 5th leading cause of mortality in the US, and it is the leading cause worldwide of disability. The greatest reasons for why people lose their jobs or cannot work anymore, even more than the pandemic overall, altogether over, if you look in the 21st century altogether, unfortunately, the reason people lost their jobs due to stroke more than they did from a pandemic in 1 year alone. So, and in 2016, which was the last global burden of disease report that was published in 2018, that looked at data all the way up from 2010, 2011 up to 2016. It showed that there were 5.5 million deaths and 116.4 million disability adjusted life years lost due to stroke. So meaning 1 year that someone lost of productivity and the increased burden, the socioeconomic and financial burden that they had to incur due to a stroke. Basically, altogether worldwide, if you pulled them all together, it was 116.4 million. But the most important takeaway here is that unlike things like cancer, stroke is largely, for the most part, treatable and preventable. Treatable now more so than ever before, but still not, depending on how quickly a patient will reach to emergent medical care and what stroke intervention facilities are available there, to where they reach nearest to where they live. But particularly preventable. There are some strokes that cannot be fully treated if they've already done the damage that they had. But as far as prevention goes, this is a significant area where a lot of intervention can be done and be very fruitful. So there's, as I mentioned earlier, there's 2 subtypes of stroke. One's called the ischemic stroke subtype, and the other is hemorrhagic stroke subtype. So ischemic stroke is basically when the blood vessels in the brain are compromised of blood flow and oxygenation. So there is some form of clot or blockage that either a blood clot that came from somewhere, or the vessel in itself, the artery, became clogged because of plaque buildup, junk buildup from uncontrolled high cholesterol, diabetes, aging, smoking, poor dietary habits, physical inactivity, all those things. So either it's that vessel that the pipes became clogged over time and then suddenly just blocked, or there was a blood clot that came from somewhere that led to compromise of blood flow beyond that area. So if there was a blood clot here, then any area that artery was supplying, so distal to that or beyond that vessel, that now doesn't receive any blood supply. And if it doesn't receive enough blood supply over a few, for a few minutes, some people can survive for even several hours, as long as they make it to a center where that blood clot is retrievable, or they can get a blood thinner, a thrombolytic that can lyse that blood clot. But sometimes clots are too far to retrieve, or are not, do not get treated with a blood thinner. The blood thinner is not strong enough. The blood thinner that we use mostly, that's most readily available, 1 of every 15 patients will see resolution of the blood clot with that medicine. It's not 100% effective still. They are coming out with better blood thinners and better clot lysers, but again, nothing is yet 100%. And these are the most common types of strokes. This is what we're going to talk more about. Comprise about 87% of all strokes. And then a smaller percentage, about 13 to 15%, are hemorrhagic strokes, which are, uncontrolled blood pressure or brain trauma or a ruptured aneurysm where some blood vessels ruptured and led to bleeding within the brain. And that obviously is less so, but again, uncontrolled high blood pressure, aneurysm rupture, leaky blood vessels, that is what can cause a hemorrhagic type of stroke. So focusing more on ischemic strokes where vessels can clog and we can have blockages in our arteries, or a clot from somewhere can come and cause an ischemic stroke, there are several different ways on how those vessels can get clogged. These are several of the mechanisms. One of them is an abnormal heart rhythm called atrial fibrillation that basically puts the heart into this clot forming mode, which then starts producing clots and throws them up to the arteries of the brain and causes a blockage. Other causes can be carotid artery disease. So the neck vessels, the carotid arteries that are coming off the big vessels of the heart and going up to the brain, they can have blockages. The cause of carotid artery disease is most commonly buildup of plaque and fat in these vessels from uncontrolled risk factors, including smoking, high blood pressure, high cholesterol, not taking care of ourselves, not eating right. And I cannot emphasize this enough, is that how much the effect of diet and lifestyle has on plaque buildup, particularly carotid disease. I have seen patients become so stable. People will come in with TIAs, they have significant carotid plaque, and particularly people who normally, if it's severe plaque, will try to go in and scoop it out. But then there are some people who don't meet criteria or for surgery, or are too high risk for surgery, or the plaque doesn't allow for surgery, etc., or stenting. I've seen patients who've made significant changes to their diet, and in follow-up, over years, their plaque has remained stable, or sometimes, very rarely though, not so much, it's actually decreased. And some patients can have a clotting disorder. This is usually seen in younger folks less than 50, but they can have a thick blood disorder where they can develop, they're genetically prone, or they develop some sort of condition which puts them at risk for clotting disorders. Some cancers can also cause a clotting disorder. And then mainly the ones that I want to talk about are these three: the carotid artery disease that I talked about, small vessel disease, and ICAD is intracranial atherosclerotic disease. All these three are basically plugging of blood vessels from plaque. So as you can see, this should have been the normal caliber of the vessel, but see how plaque and cholesterol is kind of building up along the sides of the wall. And look at how narrow the vessel becomes at some point. It should have been this wide, but it narrowed down to something really severely narrow. And if that blocks further, or the plaque builds up there even further, then that could cause a complete blockage and a stroke. So the things we're going to talk about in later on this talk are: how can we prevent this plaque from developing? How can we prevent our blood vessels from becoming unhealthy and clogging and eventually blocking and leading to a stroke? And then rarely there are patients who have stroke because of inflammation in their blood vessels. That can happen at any age, but is more common in younger.
Hi, let me call you right back. Okay, bye-bye.
So overall, there are multiple causes of strokes, but as you can see, the more common causes are related to plaque buildup and a process called atherosclerosis, or hardening of the vessels, with all this plaque buildup and junk buildup within them, consisting of fat, cholesterol, calcium, and other impurities. So the most important thing to remember is that if anyone has stroke symptoms, for example, loss of balance, loss of eyesight, facial drooping, arm weakness, speech difficulty, those are signs of stroke, and that's the time when you be fast and immediately call 911. As I mentioned earlier, stroke is not 100% treatable, but it is treatable the most if one reaches immediate medical care at a comprehensive stroke center within a few minutes to hours of developing stroke symptoms. Sometimes patients arrive so late that unfortunately the damage is already done and no stroke treatment or intervention is helpful. And then the only thing we can focus on their onwards is rehab and recovery to whatever extent people may improve. So going on and talking more about stroke risk factors, which is the bulk of our talk today. So the several stroke risk factors, and I'm sure many of you have heard these before, but most importantly, some of them that I've even mentioned earlier. So high blood pressure. A normal blood pressure that we want to target is less than, the upper number should be 120 and the lower number should be 80. So as closest to 120 over 80 you get, that's the better. High cholesterol. So there are several forms of cholesterol. There's total cholesterol, there's triglycerides, there's LDL cholesterol, there's HDL cholesterol. HDL cholesterol is the healthy one, and all the other ones are the unhealthy ones. Again, we do need some cholesterol to maintain the integrity of our skin and blood vessels and our vital organs, but beyond whatever level we need, any excess cholesterol or excess fat is harmful, particularly as we grow older. It contributes to plaque buildup. So what we normally target the most is the LDL cholesterol, the low density lipoprotein, or LDL cholesterol, which recommendations for particularly people who are diabetic or who've had a stroke. The guidelines are to control the LDL cholesterol to less than 70. And then people who have cardiovascular disease are also at a high risk of stroke because, again, the same process that I described of plaque buildup and cholesterol buildup, the odds are if you have it in one place in the body, say if you have it in the heart, the odds are the same process is also happening in the carotid arteries or in the brain. So the other way of looking at it is if you control your risk factors to reduce heart disease, you're also going to reduce carotid disease and stroke disease risk as well. Diabetes is another major risk factor. So there is the glucose that the newer guidelines recommend. Fasting blood sugars should be less than 100 milligrams per deciliter. And the average glucose number, or the glycosylated A1C number, which is a percentage of what your average blood glucose should be less than 5.7. 5.7 to 6.5 is pre-diabetes, and higher than 6.5% is diabetic range now. It used to be 7% or higher was diabetic, but they've reduced that to 6.5 because and we're now treating people with pre-diabetes just like they have diabetes, because we know that the effects on the blood vessels and the brain and the hearts and the kidneys start to happen even in the pre-diabetic range. So it's very important that you're following up with your primary care doctor and these numbers are being looked at. So blood pressure less than 120 over 80, cholesterol less than LDL cholesterol less than 70, good heart health, A1C target less than 6.5, but if possible, less than 5.7 to stay out of the pre-diabetes range. Smoking and or illicit drug use is a very major risk factor for stroke. Similarly, heavy alcohol use. I'll go into a little bit more detail about smoking in a bit, but heavy alcohol use. So what's heavy? Anything that's more than 1 drink of alcohol per day is heavy. And for men, no more than 5 to 7 drinks per week. And for females, no more than 3 to 5 drinks per week. Sleep apnea kind of goes synonymously with obesity. People who are either overweight, obese, or people who have some sort of obstructive process going on in the back of their nose or their throat, who don't get enough oxygen while they're sleeping because of obstruction of the airways. This inadvertently increases your risk of high blood pressure, high cholesterol, heart disease, and weight gain. And then the other major risk factor is lack of exercise. So all those are major stroke risk factors. So when someone has a stroke from atherosclerosis or blockages of the blood vessels in the neck or the heart or the brain, these are the things beyond, the prescription of aspirin or the blood thinner or the cholesterol medicine that you're prescribed. It's really focusing on all of these things and reducing your stroke risk factors. So these are, again, the things we talked about. These are the modifiable risk factors. So there are non-modifiable risk factors like aging. None of us, whoever figures out a way to reduce aging is going to win a Nobel Prize for sure. So we can't reduce aging, and we can't change our genetic makeup. Some people are genetically prone to, diabetes runs in their families, or cholesterol, hyperlipidemia, or high cholesterol runs in their families. And it's not about how big or how thin you are. Some people just have a genetic predisposition that their liver cannot metabolize cholesterol as well. I've seen people who are very thin, very lean. Their body mass index is very normal. Their weight's normal, but the cholesterol in their vessels is still very high. Whereas vice versa, I'll see some very chubby people who, you do their blood cholesterol and it's totally fine because they're eating fine and they're just genetically, able to better metabolize fats. So those are things we cannot change or cannot modify. But things we can modify are the high blood pressure, high cholesterol, smoking, diabetes. If we detect an abnormal heart rhythm, we can treat that with blood thinners. Sleep apnea, we can treat that with a CPAP machine, which basically is a machine that you use to help increase the pressure of oxygen and air go to your lungs. We can treat physical inactivity by being more active. We can change our dietary habits and avoid excess alcohol consumption. So the National Stroke Association gives a sort of a nice stroke risk scorecard, which basically, you want to make sure that, again, the things you want to be are these. You want to have a blood pressure less than 120/80. You want to have a regular heartbeat and not any abnormal heartbeat like atrial fibrillation, a non-smoker, the total cholesterol less than 200, and LDL cholesterol less than 70. You don't want to have diabetes. You want to exercise regularly, maintain a healthy weight, have no family history of stroke. Then, of course, overall, your risk of stroke is going to be low. But if you're any higher, particularly if you have any of these, then that's where you should take caution and try to go towards the greener side. But if you have any of these, this is where, particularly if you have 3 or more of these, if your blood pressure is higher than 140/90, you have irregular heartbeat, you're a smoker, your cholesterol is greater than 200 or 240, and your LDL is greater than 70, or particularly in the 100 range. If you have diabetes, if you're a couch potato, if you're overweight, if there's a stroke risk in your family, then all these things, of course, are going to increase your stroke risk. So moving on to what type of life changes can help us with stroke risk reduction. So one of the most important ones is smoking cessation. So, it's become very fashionable to smoke in, the past 4 or 5 decades. And particularly now it's seeped into the younger generations even more so. But it is particularly a very significant stroke risk. And I can share with you some data here from several studies. So the Nurses' Health Study, which was a large study looking at thousands of nurses and surveying them for their health risk factors, and also gave repeat healthcare visits to nurses and monitored their risk factors and their stroke risk and heart disease risk as well, showed that smokers had a 3 times higher risk of stroke compared to never smokers. However, the excess stroke risk disappeared within 2 to 4 years after cessation of smoking. Now, there's another study out of Framingham, Massachusetts, which is one of the most famous studies of heart and stroke disease risk factors. And that showed that in the Framingham Heart Study, there was an 8% higher odds of developing more than 50% blockage in the carotid arteries for each 5 pack years of smoking. So if you smoke 1 pack a day for for 5 years, your odds of having more than 50% blockage went greater than 8%. And if you smoke for 10 years a pack a day, then it's 16% and so forth. And then the Swedish cohort study, European patients, 10,000 patients that were enrolled, almost 39% strokes that were seen in that cohort were attributed to smoking. So a significant number of strokes that are caused by smoking alone. So dietary changes, their diet is the world of nutritional and dietary changes and lifestyle changes is such a huge area that can be intervened upon. And there's a lot of growing literature about how our stroke risks have increased, now in the 21st century compared to the 18th, 19th century, where people were dying of infections, but not from heart disease or stroke this much, because back then their diets were more pure, they were less synthetic, their physical activity levels were a lot more. They relied less on machines to do their work. They relied more on, people doing work themselves. And they had better and more pure, non-synthetic, non-processed diets. So you want to make sure that your diet is constituted of multiple different portions and good proportions of grains, vegetables, fruits, dairy, and protein. There's this really nice website called myplate.gov, which you can go on to look and see, what proportion or what type of foods you're eating and how they're either appropriate towards what the recommendations are, or how far away from those recommendations you are, and allows you to modify your diet accordingly. And really, just in a nutshell, you want to choose vegetables and fruits in good amounts. You want to make sure that at least half of your food choices come from healthy grains, vegetables, and fruits. And you want to eat nutrient-rich dark green or orange vegetables compared to vegetables that, for example, that are more starchy, like potatoes, for example. You want to choose low-fat dairy and fat-free foods over high-fat foods. And you want to choose, when you choose proteins, choose low-fat or lean meats like poultry and fish, and also beans and nuts and seeds, instead of high-fat red meats like pork, bacon, red meat, beef, or cuts with a lot more fat. And in terms of fats, you want to make sure that those fat sources are coming from natural sources, like fish, nuts, and vegetable oils, and rather than things like margarine, butter, shortening, or lard. So very quickly, I'll go over 10 dietary strategies to reduce your stroke risk. So one, as I mentioned earlier, you want to eat a variety of foods each day. And one good way of looking at it is try to, put as many colors in your diet as possible, because then that will make sure that that'll help you make sure that you're adding enough nutrients of different sorts in your diet. You want to choose at least 3 to 5 cups of fruits and vegetables each day, and you want to make sure that you really read food labels. Particularly, we buy a lot of our foods prepackaged now, particularly snacks. And one thing you want to make sure is to read exactly what you're eating. How many calories are in each serving? What's the amount of total fat? And the fats that are bad are the saturated and trans fats. You want to look for more unsaturated fats. You want to see how much cholesterol and sodium is in that diet, and whether or not there's enough fiber in that diet at all. And what you really want to do is try to limit your intake of saturated and trans fats and also cholesterol, because saturated fats can tend to solidify at room temperature, and those are the ones that are going to clog your arteries, whereas the unsaturated fats are dissolvable and they don't clog your arteries. And so the saturated fats that clog your arteries are the ones that come from high-fat meats like pork, bacon, red meats, cheese, egg yolks, butter, ice cream, and even some vegetable oils like palm oil, palm kernel oil, coconut oil. Most of these like high fat snacks that you find in the grocery stores, like caramel popcorn or granola bars that are really rich in energy, etc. They have a lot of palm kernel or coconut oil. And this is just a list of substitutes, and I'm happy to share these. Actually, I can share a reference, which of a website which has sort of all these things, where you can actually substitute, the things on the left for things on the right. So I won't go through the entire list, but instead of butter, use like light butter or diet margarine. Instead of regular cheese, using low-fat or non-fat cheese. Instead of whole milk, use non-fat or skim milk. Instead of cream cheese, use reduced fat or non-fat cream cheese. I also recently discovered this almond milk substitute for cream cheese that I picked up from Whole Foods, which you cannot tell the difference whether or not it's cream cheese or not, and it's equally delicious but significantly lower in calories. And things like Alfredo, instead of Alfredo sauce or other creamy sauces, using olive oil based sauces or tomato based sauces. Instead of mayonnaise, using something lighter. And instead of chicken with skin on, use skinless chicken, or instead of whole eggs, try to substitute with egg whites, etc. And then trans fat substitutes as well. Instead of deep fried foods, choosing baked and grilled or broiled foods. Just trying to avoid hydrogenated oil and use more non-processed vegetable oils. A mistake that we commonly make, like granola bars, we think they're healthy, but if there's a lot of hydrogenated oil or coconut oil, then those are again going to be higher in saturated fats, which clog your arteries. And instead, you want to choose granola bars with canola or olive oil or other healthy liquid oil. And then one interesting thing that I learned was instead of powdered creamers, like we use a lot of Coffee Mate or powdered sort of substitutes instead of milk, and particularly some of them contain hydrogenated solidified oils. So instead of that, you want to use either non-fat half and half or skim milk. And then kind of like the obvious thing, right? So healthy snacks should be more healthy with that are also filling, but have good quantities of vegetables, essential oils, essential fats. So this is a Mediterranean diet snack. And so snacks can be nice, nutritious, and yummy. And they don't have to be, high in sugar and high in fat. And the other thing that you really want to make note of is how much sodium is in our diets. So a lot of the things that we buy prepackaged have a significant amount of sodium content in them. And you want to look for, particularly if you have high blood pressure, you want to look for diets that are low in sodium. So looking at foods containing less than 140 milligrams of sodium. In total, guidelines recommend no more than 1,500 milligrams of sodium per day. So keep that in mind as you're, selecting your foods. And then choosing foods that are high in fiber. So how to get more fiber in your diet, basically, having whole fruits instead of synthetic fruit juices, choosing brown bread, whole grain breads, whole wheat pastas, adding fruits and nuts to your snacks, for example, your yogurt, adding vegetables more to your diet and soups, and substituting sort of white enriched breads and rice with brown rice and more natural, fiberful choices. And then perhaps one of the harder things is maintaining and achieving a healthy body weight through persistent exercise and diet control. So guidelines recommend, the American Heart and American Stroke Association guidelines recommend moderate intensity exercise for at least 30 minutes a day, 5 days a week. And, sometimes it's hard for us to build that into our routine, but things we want to do, and something that I've recently started doing is, you want to try to walk, particularly if you're going a short distance, try to walk instead of drive. Try to start, some fitness exercises, particularly with a gym buddy or friends or other colleagues. And then you want to make sure that, when you exercise, you reach the level where where you're breathing hard, but you can still talk. You don't want to overdo it. You don't want to put yourself in a state where you can't catch your breath. That's when you know that, you shouldn't be going beyond that. But things substituting, like taking the stairs instead of taking the elevator each time. And if you don't have time for 30 minutes at one time, five times a week, you can always try to do shorter workouts, 10, 15-minute workouts, but more frequent. And then another thing that we fall prey to is the amount of added sugar in our diets, in the beverages that we drink, and the foods we eat. So try to limit that. And also, there have been links of low potassium also increasing your stroke risk. So making sure you're getting enough potassium. And potassium you can find in citrus fruits, and also in green leafy vegetables and orange colored vegetables as well. So that's a good source. Dates are a good source of potassium, bananas, oranges, etc. And lastly, I'll just end with, this is a chart that helps identify one of the most helpful diets for heart health is the Mediterranean diet. And the Mediterranean diet basically consists of much of what I've already told you, but it really takes that and puts that together into sort of a proportion in diet. And so really wants you to have healthy oils, a diet that consists of vegetables, fruits, whole grains, and healthy protein. You don't want to go, too much towards one end. And if you can see, most of the bad diets are the diets that are very high in saturated fats, don't have much vegetables and fruits, have very little whole grains, but have a lot of enriched white carbs and starchy foods. And whatever protein is in there, it's smothered so much in saturated fats that it kills the purpose of a healthy diet. So even though you think that you're having protein, but there's so much fat that goes along with it. The most notorious are protein bars. You pick up a protein bar, at the very front it'll say, this thing has 12 grams of protein in it. And you look at the back and it says, yes, 26 grams of carbs and 30 grams of fat. So those are things you want to be mindful of. But the Mediterranean diet, which is one of the most proven healthy diets for healthy hearts and healthy brain health, is the diet which contains, recommends healthy oils like olive and canola oil for cooking to add on top of salads, and avoiding trans fats and saturated fats, limiting butter, and then recommending that the more veggies, the greater, but avoid potatoes and French fries because they're very high in starch. Eat plenty of fruits of all kinds and colors, drink lots of water, try to limit dairy, so 1 to 2 servings a day is fine, but not too much. Avoid sugary drinks, or fresh juices are better than prepackaged synthetic juices, which have a lot of added sugar. You should incorporate a lot of whole grains, like as I mentioned earlier, whole wheat bread, whole grain pasta, brown rice instead of white rice, white bread. And then healthy proteins. Choose fish, poultry, beans, and nuts, and avoid red meat, cheese, bacon, cold cuts, and processed meats. And, if you do this plus, and all of this, most importantly, is going to help you control your blood pressure, control your cholesterol, control your blood sugar, maintain a healthy weight. You can take all the aspirin and all the cholesterol medicine and all the diabetes medicine you can, but if you're not controlling the diet part of it, medicines can only do so much. And I think, we all can do it, and, we all can at least try. It's hard. It requires persistence. I myself, see myself falling prey to sometimes not being able to persistently do things and follow these same recommendations. But as long as we continue to redirect ourselves and try to bring us back to healthy lifestyles, that is what is going to help us continue to maintain a healthy heart and brain health, and prevent stroke in the long run. And not just stroke, heart disease and stroke together. So thank you very much. I'll stop there. I would love to hear any questions or comments, and if any of you want to share any stories of how you've made significant changes to your lifestyle, or your loved ones have made significant changes to your diets or your lifestyle and how they've worked for you, or if anyone feels it's been challenging for them and in what ways. And I'm sure everyone has pandemic stories to tell, that how the pandemic certainly has made it a lot harder for us to act upon these guidelines. And lastly, I just left some helpful resources here, which you might find helpful, which can guide you towards making some of these healthy lifestyle habits. And I will stop there. Shannon, back to you.
Thank you so much. Thank you so much. Does anybody have any questions?
Go ahead and take down the screen. I can't see anybody.
Okay.
Well, I have one. What is this, Dr. Carl?
Yes, please.
I'm actually a younger patient that had one of the 13% strokes. I had a hemorrhagic stroke. Is there any data on it? I mean, I am so scared of having another stroke. So this talk was great, because I am following everything that's on that right now, because I am scared to death to go through what I just did. And I'm living everything that you just talked about.
Yeah,
I'm doing now.
Excellent. Well, you're a great role model for us then. As far as hemorrhagic stroke risk, so it really depends on, firstly, what was the cause of that hemorrhagic stroke that you had.
It was high blood pressure and cholesterol.
Yeah, that I was going to come to that because that is the most common cause of hemorrhagic stroke. Now, oftentimes what happens is, in addition to high blood pressure, there is some other factor. Why did you have a brain bleed exactly here and not here or here? Oftentimes it's thought that there was some weak area in that blood vessel, be it a vascular malformation or a weak connective tissue, or an aneurysm, or some vascular malformation that led to that area to bleed. But particularly, we do know that the deeper areas in the brain, the basal ganglia area, or the back of the brain, the balance center, the cerebellum, which is called cerebellum, or the deeper brain.
That's where my stroke was.
Yeah. And so those areas are more prone to hemorrhagic strokes, because they're supplied by the more tinier vessels, and those vessels are not as strong and cannot withstand such high blood pressures. So when anyone has a really high blood pressure, it can lead to rupture of vessels in those areas. And so really, in order to prevent a hemorrhagic stroke, one of the most important things is blood pressure control. So for you particularly, making sure that your blood pressure is less than 120/80, you're reducing your sodium intake, you're exercising, all those things. And I think this is proof to you. You said you're doing all that, and you haven't had another hemorrhagic stroke in decades, basically. And so I think, one, as I mentioned earlier, it is fortunately only 13 to 15% of all strokes is hemorrhagic. But the other thing I would say is, now, as you grow older, obviously avoiding any sort of head trauma or any high risk activities that may put you at risk for head trauma. But more importantly, controlling that blood pressure, reducing your salt intake, increasing your fluid intake, exercising, and living a healthy lifestyle as you're doing really is the best bet. And the other thing I would suggest is, sometimes people can have high blood pressures but not know that they have high blood pressure. They can just not have symptoms. So I'm sure you already do, have a blood pressure machine at home.
Yes, I do.
Don't like incessantly check so much that it makes you nervous. But check, maybe twice a week, once in the morning time and once in the evening time, and record those blood pressures. And when you go see your primary care doctor, you should, say you go see them after 3 months, you should have at least, 2 blood pressure recordings a week, 8 to 10 recordings a month. And when you show your primary care doctor and yourself, look at the fact that you have, 25 to 30 blood pressure recordings over 3 months, and they're all within, the 120/80 range, then that is a good sign. But when you start to see, say, 5 years from now, as you grow older, the vessels do harden. And so inevitably, sometimes the blood pressure is going to go higher. And if you start noticing that, compared to 2019 or 2020, now my blood pressure is persistently running in the 150/90 range, or 150/100 range, then that's the time to start to talk to your doctor about starting a blood pressure medicine as early as possible.
I appreciate that. Thank you.
My
Hey,
pleasure.
Stephen, I got a question for Stephen. Hey, Stephen, how much weight have you lost if you're following the guidelines he had there since your stroke?
Oh, since my stroke, I probably lost over 25 pounds.
Okay.
And I'll be honest with you, I mean, I can't run, I can't do any of that stuff. The only thing that I do is the elliptical and I ride the recombinant bike.
That is, Stephen, I can't run either. I had asthma as a child, and it left me with exercise-induced asthma. So I can run maybe a mile max, and then I get short of breath. But the elliptical has been a great thing for me as well. Elliptical, swimming, bicycling, those are things.
I am so scared to death to go through what I went through. I mean, I'm grateful and humble to be alive, but I'm so scared to go through what I just did. That's why my diet, when you talk about the blood pressure, I mean, everything. I mean, I get my blood pressure taken twice a year, and my doctor said they wish they would have taken a video of me before and after, because I'm in better shape today than I was ever in my life.
That's excellent. That is excellent. Very admiring. When was the stroke again?
Actually, I just celebrated my 7-year anniversary.
7-year anniversary. Congratulations.
Thank you.
Anyone else have any comments or questions?
Well, for me, my stroke was 5.5 years ago. I was starting to lose some weight before. I lost about 40 pounds before the stroke, 40 pounds after the stroke.
Wow.
So I've come a long way, but I've got a long way to go in that I do have some activity, but my problem is to do something habitually, consistently. I could start and stop, start and stop. And with the pandemic, it's been so easy to make an excuse to just stop and stay stopped. So my question is, I mean, I do a lot of the modification as far as the diet. I eat a lot more like brown grains and healthy poultry and a lot more vegetables and fruits, but I benefit a lot from an extra pair of eyes. For a little while, I had a personal trainer. Anytime I went to therapy, any activity with somebody, and makes you do a little bit more than you were anticipating doing.
100%. I will say one thing that I recently started. So one of my best friends from college is a physician and a physical trainer, and he has always been willing to be there virtually because now we can. And I've started doing workouts with him virtually over FaceTime, and he does his, I do mine, and it's helped significantly because I know that there's someone checking. And even though with my very busy work routine, it's very hard to take out time. Trust me, I get up 6:37 in the morning and come to work, and some days earlier than that. And sometimes work doesn't finish till 6, 7, sometimes 9, 10 o'clock at night, or sometimes there's some other activity after work that requires time. And so it's very hard to take half an hour even to go do some exercise. But the rule of it doesn't have to be half an hour together or 60 minutes. It can be 2 15-minute workouts. It can be taking the stairs instead of the elevator today for 3 flights, for example. Or it can be, I will cut down my proportion of lunch today. I will eat, just a small salad because I didn't get to work out. I will cut down on the calories. I'll cut down today's diet by 200 calories because I couldn't work out for those 200 calories. But having someone there, I feel that it has significantly helped me in the fact that one, I know someone's going to be, on my butt to ask, did you work out today? And secondly, just to see, like, am I doing the things right? A lot of us don't really have the athletic awareness that it takes to do I mean, it's easy to hop on a bike, etc. But when you're personally doing, fitness training or some exercises to help get everything in shape, sometimes you require some additional exercises or weight training, etc., things like that. But having someone just watching you virtually, I initially thought this was going to be dumb and it's like not going to work, not going to be the same as someone actually being there and helping you out. But it has been nearly as equally great, and the results I'm seeing are still very similar.
That answered my question. I was going to ask, what do you recommend as far as getting a second pair of eyes? And you just said a nice virtual workout buddy. That's something I'll look into.
Absolutely. My friend just tells me, he's like, he just has me put like I go to the gym in my building, and he just says, put the phone on the floor so I can see you head to toe. So it gives him like a big view of, he can see me head to toe what I'm doing, and he'll have me, do small little exercises, and knowing, what my schedule is like. And so it's short workouts, but I feel very uplifted. I feel like and it's not just the weight loss, it's about getting in shape, right? And
Right.
increasing your stamina. Like, for example, I shouldn't be getting short of breath if I have to run from here for, an emergency stroke code. And if, God forbid, I ever do feel that, that means, I haven't been in my exercise routine for a week, and that's why, and one thing when I actually realized, I actually was trying to, this was 2 years ago, I was trying to lose weight and get back in shape for an upcoming event, which I had to travel for. And there were some weddings in the family as well. And I started doing, fitness training. And one thing that my trainer would make me do is something called a suitcase hold, where you kind of, make sure your posture is upright and you're holding some weight and walking. And I realized how much it actually helped me, because 2 months later, I was literally picking up my 23-kilogram suitcases up in one hand and walking with them, because there was like some place where you couldn't roll them, so I had to like pick them up and put them up on pavements or walk through. And I was like, oh, this is so much easier than I could not have done this 3 months ago. But just in short durations, you'll notice how great results you get by being persistent. But particularly in the pandemic, what I did was, when we couldn't go out to the gym, when gyms were closed, I bought an exercise bike and just brought it home. So, and you don't need, that's what my trainer tells me, you don't need equipment. All you need is a 6x6 or 6x4 little area to just, an area to yourself, like a yoga mat, enough room to fit a yoga mat, and then your own body weights can help you. You can use your own body weight to help exercise and do some exercises that'll help you, be able to keep that weight off and get back in shape gradually. But one thing I've truly noticed and has been told to me, and I have to be reminded even as a physician myself, is exercise alone is not going to do it. Diet alone may not do it as well, but the combination of diet and exercise and risk factor modification is really what's going to give you those results. But we have Stephen as an example right in front of us, right? I mean, 7 years stroke free, from adhering to all that. Stephen, how much do you exercise in a week?
I'll be honest with you. I'm an addict. I go 6 to 7.
6 to 7.
I gotta be doing something. I got major tremors in my left side.
Yeah.
So when I work out, I can't do weights or anything like that. I have to use resistant bands.
Yep.
And when you said body weights, I'm an old believer. I mean, I never could do push-ups, but I started out doing modified push-ups.
Yep.
But right now I have no problems. doing 50 push-ups. To me,
Wow.
that is unbelievable.
Wow, that's amazing.
But I wanted to say something. I was a big believer in, when you were saying the exercises, I've never done this. I just started to do this. And I'm probably 2 months into it. I never tracked my diet. Never. I never tracked what I ate. And I just lost probably within the last month 10 pounds. And I'm not overweight. Right now, I was always, like I said, I always like to lift and stay in shape. And I was always 190. Right now, I weigh myself, I'm 177. And I watch, I macro, when I say macro, I put in what I eat for breakfast, what I eat for lunch.
Yeah.
Sodium, everything. I know exactly. I track it.
Do you use MyFitnessPal or something else?
No, I use MyFitnessPal.
MyFitnessPal, right?
Yes.
That's the app that I use too. So MyFitnessPal is an app which basically everything that goes in your mouth during the day for food goes into that app. So you're having a cup of coffee, you're having a sandwich, whatever you're eating, you log into that app. And I can tell you, even as a physician, when I started doing that, I thought, you know what, okay, like I'm eating healthy now, I'm eating right. This is gonna help me, get in shape and lose weight. And I did it for a good three weeks. And I was like, I'm not really seeing much. I haven't really lost more than about 2 pounds. But as I started logging things in that app, and it very nicely gives you a summary of your whole week, and it gives you the consequence. So at the end of you can either get a daily summary or a weekly or a monthly, but at the end of the week, it gives you a summary about, on average, in any given day, this is the amount of protein you're taking, this is the amount of carbs, and this is the amount of fats you're taking. And I was surprised to see my own loggings. I was like, I thought I was eating great, but actually, I am still eating very little protein and a significant amount of carbs and fats still. And when that sort of reflected upon me that, oh, this is something I need to work more on, and that's when I brought down my carb intake, my fat intake I reduced, but I substituted it with the unsaturated healthier fats and increased proteins and vegetables, and I saw results significantly. So I agree with you, logging things and using technology in your favor. And it doesn't necessarily have to be out. For those of us who are not very tech savvy, you can also, do it on a chart, on a paper chart, for example. But most importantly, I think the most important thing and the hardest thing is starting somewhere. You have to get up and say, you know what, today is the day and I'm going to do it. Because we all say tomorrow, the day after, okay, Monday, and then that Monday never comes, or that tomorrow never comes, until a year later or 2 years later, we're 20 pounds heavier. And I mean, I've had that experience at least more than once. But the more we motivate ourselves and push ourselves, I think that's where we're going to be able to do this. But I think the most important thing is, like, even without exercise, and we're not talking going to the gym and running on a treadmill, walking, like going for a walk in your neighborhood, or instead of, if you're just going to go 3 blocks to a grocery store or 2 blocks to, the nearest convenience store, instead of taking the bus or instead of, driving there, try to walk there. It's beautiful weather nowadays, and, trying to get as many extra steps. Another sort of way to incorporate technology is a lot of people started using the Fitbits and, tracking how many steps. You can even track those in your phone. Most smartphones track that for you. Seeing the number of steps you do. And again, after a stroke, it's very harder. Sometimes it's a lot harder depending on what deficits you've suffered from a stroke. And, you shouldn't be like thinking, oh, just because I didn't get 10,000 steps, I didn't do anything. No. If last week you were only able to take 300 steps a day, and this week you're doing 350 steps a day, that's progress. And so just try to build gradually more and more. As long as you're making some positive change, that is all you need to eventually be able to have a healthier life and reduce stroke risk at large. Well, thank you so much, everyone. It has been a pleasure talking to you. And I would be honored to speak with you again at some point. But if any of you ever have any questions or comments, please reach out to us. You can get our information, particularly the Cerebrovascular Center here at the Cleveland Clinic. We see patients of all sorts with all types of cerebrovascular disorders. My wish is hopefully I never see any of you in my clinic, and I only see you on support groups like this here. If ever you know of anyone who needs help, we're always happy to be here for you.
Thank you for the talk. It was great.
My pleasure. My pleasure. Good evening to you all. Okay.
Thank
All
you.
the best for college.
Thank you, Dr. Kharal. I can't tell you how much of an inspiration this was. And just in the spirit of that, my yoga class started at 6:30. That's what I'm doing right now, doing a virtual yoga class.
Oh, amazing. Living example.
Yeah, that's what it's something that we've all kind of adapted to over the pandemic to be virtual. But I think you're right, the virtual buddy, using the fitness app, it's helped me tremendously keep track of my mental well-being as well as the lifestyle stuff. It's hard, but we keep at it. I think we'll get through this year too. Thank you, everyone.
All right. Thank you so much.
Bye.
No, I know our next meeting is scheduled for April 29th. So everybody mark your calendar for that. And I think that Cindy was talking about possibly getting together on sometime later in the summertime, hopefully being able to get together for an outdoor picnic or something like that, where we can, just see what's available, maybe in a park or something. We'll bring chairs and bring a packed lunch, and just to be able to wave at each other in person. So keep your eyes open for that once we can get that nailed down. So.
Thank you.
All right.
That'd be wonderful. Thank you.
Thank
Good
you
night,
so much.
everyone.
Yeah,
All
great to see you guys.
Bye.
Virtual hugs. Bye.
Bye-bye. See you next time.
Thank you.
Everyone take care.
Thank you, you too.
Thanks.
See you online.
Okay.
Look over and smile. Look over and smile.